tell them to do it. So you can put out a list, and there might be those naysayers that, call certain restaurants out. Like, I went in and they didn't have that on. And one, they could be lying. Two, it could have happened. It could just be that one employee that was a bad apple. And I struggle with what's the best way to get that information out there and make sure it's accurate.
So Eddie, what do you think about, because if you're out and about eating 8 times a week, by the way, which that's amazing.
It's sad, actually, but yeah.
I mean, I eat a bag lunch at my computer like every day, so I never get out. So getting out to me is like, oh man, it's like a holiday, right? Like, but I have kids, and you can't take them out in public. So not at this age. What do you think though about maybe, what if there's like almost like a self reporting, where almost like we've signed a pledge to keep our community and customers safe, which means that we're doing this, and this. Like, we have our employees wear masks, we ask for masking, we ask for social distancing, we strive to create a environment that gives that creates the safest environment possible. Something like that. Like maybe like almost like I mean, we call them abstracts. What do business people call these? Like almost like a mission statement, right? Like almost thing that says like, we're doing this.
Decal.
Is what?
Like a sticker decal to place on the door or something like that?
We're like maybe a green check mark or something, or like something along, or picture the virus to the next through it. I don't know, something along those lines. Like, I wonder if we could get, I think other cities have done this, where they've kind of sponsored, this is the practices to keep everyone healthy. If your business is doing this and you say, yes, we're doing this, then we'll give you this. You can put this in a window. I don't know. Do you think that's something that would, just your experience in different restaurants and talking to owners and stuff, do you think that's something that people would be interested in, or that kind of separates them apart?
I think there's people that want to know a list. I mean, there's still people that haven't gone in and dined in at a restaurant, and they're waiting just to make sure that restaurants are, practicing everything properly. And I think putting everything on the restaurant, like you said, having them, self check in, or whatever the word is, to say, hey, we're practicing, the mask, we're practicing social distancing of the tables, we're practicing the gloves and whatnot, and it's putting it on them. Because I think if you were to put out a list, or if I were to put out a list and it was inaccurate, I think we catch more of the heat than anybody else. Yeah. So put it on the restaurants themselves would probably be the best practice. And I know there are a lot of restaurants out there that want to be on a list like that. Like, when I put that question out there about putting out a potential list, like, I had quite a few restaurants reach out to me like, hey, we're doing A, B, and C, and we'd love to be on it, and feel free to come on in and check us out. So there's opportunity there, and there's a desire from many owners to be on a list like that.
Okay, because I'm thinking about just kind of taking a page out of the book of the cosmetology industry, where, and to be honest, some of the martial arts industry, where while things were shut down early on, they created like certification programs that say we're COVID certified, right? Like, I saw this with a lot of people who, in the cosmetology industry, which means like they took extra training and now they receive something they can physically show folks, and they did it on Facebook. And then, like I said, I also saw this in this this group that does international seminars on self-defense. They also started offering COVID training seminars of certification, right? Like, people kind of rose to that. So I'm wondering if it doesn't have to be like a training or anything, but maybe just and maybe I get the city to do this. Gone through where we pretty much check these 10 things, right? You go through, you read these things. If you commit to this, click here and sign, and then they can get a decal saying, we've gone through not the training, but the education of keeping people clean or things clean and COVID free, and we have agreed to follow those standards. Like, I mean, that might be something we could look into. But someone's chatting. All right.
Can I throw out just a couple of model ideas, or a thought I've got?
Andrew, I can't really hear that well. Let me turn up my thing, but
is that better?
Yeah.
Okay, sorry. As an example, not to say that we would go to the Kansas Restaurant and Hospitality Association, but they have a Serve Safe program that is for bars and restaurants to use to certify managers to become at a higher level of understanding of food safety. It's a part of the regulation being kind of driven by the industry itself. So creating better tools than the cities used to have and offer the counties. So long story short, they created a program called, oh crap, I can't remember the name of it. I'll think of it in a second. A Trusted Table. And that was a program kind of like you described, where you could get managers on record of having certification enough to where like there's one all the time on. So you have this food safety expert on site, and then you would be part of the Trusted Table program. There's just a couple criteria: being a member, having that certification. And so we could potentially look at a model like that. I don't think that, I can't speak for the association as to whether or not they would want to manage a COVID-related model. I think that's probably not of their interest, but not to say that another entity or organization could, or the city could, or somebody could. To someone's question, Faye's question, I don't think that the Kansas Department of Agriculture is going to regulate health-related matter in this way any differently than they would handle food safety. So I don't think they would be the authority to manage that. Not to say that Eddie couldn't do it, or and I did want to throw out there that Adam and I had been talking and have actually inquired with a group of people that is interested in maybe taking on this project. And they're a collaborative group of people that would be working on it, which I think is easier to spread out the workload. Because if you ask Eddie to update his database daily, he's going to probably say no. That's a lot of work and no revenue, right. No money for that, so I can't reveal any information yet because it's in the hands of these other groups. But there's a possibility of someone that's actually wanting to do that. It takes it out of your hands, Brandon. So it's not Brandon telling everybody what to do. It's a resource for us all to use. And it's going to have potentially have good distribution capabilities, which is a big part of this. If we created our own thing, not everybody's going to see it. Not everybody's going to know it's there. So we need to figure out how to get it out to the public, because as we've discussed, this is a public issue, and people participating in health-related matters, not just the government telling us what to do. It's bigger than that. So anyways, right. Those are my thoughts.
And the goal, sorry, I didn't mean to cut you off in the end there, but the goal is to get, I'm excited with this idea because the goal is to get buy-in. Like, because government telling you what to do doesn't mean everyone does it, right? Like the goal is to get like shared buy-in from stakeholders who want to go forward with this stuff. But you're mentioning something really your idea here is a lot smarter than mine, right? Where, well, the city, we can do it this way. Because the reality is, if we had like a hospitality association, or something that, first of all, like understands the industry, like really understands these industries, and then also has experience and has that trusted brand, right? Like, by the way, government does not have a trusted brand usually, but trusted where, I trust that this group, even if it's a group of just owners, right, who kind of came up with their own group and then they're following standards like CDC standards or whatever. When it comes to like music and entertainment, like you should trust Adam a lot more than me, right? Like when it comes to food, for example, reviewing food, you should definitely trust Eddie a lot more than me, right? Like, so how can we utilize, I guess, the resources we have and empower people who want to kind of take that on, which would do a greater good. The greater good we want here is to not only get people who want to get on a list that like they want to comply, but also people will want to go to places that are safer. Like, how do we, so I think that let's keep working on that then, Andrew. If you could keep, and I know you said that it's all it's at the beginning stage, so you're not ready to make a report on it, but that is probably where we should be heading. And there might be, and let me know if you, oh my goodness, Janet, I just got hit with an idea. It doesn't happen often, that's why it sounded like that. Janet, if you're honest, please let me remember to ask Sarah to research policy that other cities or organizations are doing to kind of give a stamp of approval or a status for small businesses and restaurants that are doing COVID safe stuff. Because I bet there's other places that are already on top of this, and we could probably just mimic their program. So if I get my policy researcher to research some of that and pass it on to Andrew, then we could probably mimic something that's already out there instead of reinventing it. Does that sound good, Andrew? Would you be open to that?
I'm open to anything. And just because a group is looking at it doesn't mean they're going to say yes. So, right. Well, we're going to present this, and I think this video is actually going to be helpful to them to hear what Eddie says and what he's done and what he's seen, hear what we're saying, because I think they're going to be able to watch this and decide, is this a worthy cause that they can support? So we'll just have to see. I'm going to send another message out just now, just about how this needs to be about comprehensive community, not just about the food business, because we're missing out on this if we're just focused on food.
No, you're exactly right. And yeah, and I think we still get because of earlier this year when I think the gyms and restaurants, once you got to that red zone status, it was gyms, restaurants, and nightclubs that were targeted by the White House task force. And that really kind of, I think, put that industry on defense. And the reality is, can we do something more global or more universal? Or I don't want to confuse anyone with my words here, but something that encompasses more a larger span of the economy than just kind of micro targeting certain groups. But if we got industry leaders in those groups who are respected in our community, who help formulate what this is, like, that's going to have such a higher potential for success, I think, than someone in City Hall doing it. So I'll try to get some research done in the background on what other cities have done and what they're doing, and maybe more towards what is a community approach, and then I can pass it on to you guys. And if it's something that influencers in the small business community wants to take on, then we can. I mean, if not, and nothing happens, like, at least we looked into it, right? Like, so that's the biggest thing is with COVID, I'm learning there's no do-overs. And there's no blueprint. So we want to just kind of explore every option instead of just defaulting on not doing anything. So, okay. Any other questions? Did Eddie get off, or no? Eddie's on. Cool. Eddie, do you have anything else to add?
No, I appreciate the opportunity. Thanks for the invite, Tyson. And if you guys need anything from me, feel free to holler at me anytime.
Excellent. So your website is foodbyeddy.com or foodbyed? Or Wichita by Ed?
Say again?
What's the website, just one more time?
It's wichitabyeb.com.
ED. Okay, wichitabyed.com. Or EB. Okay, excellent.
Yeah, B as in brother, yeah.
All right, good. I want to make sure we get on the minutes and we can get that correct. Thank you, sir.
There's a link in the chat too.
Perfect. All right, good. Yeah, I should have checked there before I asked. All right, so continuing discussion, how to keep businesses open safely with increased COVID numbers. I think we kind of already crossed into that next item a little bit, where I do just want to give a bit of an update. And the next item after that, we got to really kind of jump into. So I don't want to like rehash out last meeting, because I want to make sure I have time to jump into the next item too, which is wreaking havoc throughout the country, I guess. So I try to have a discussion on this with the council about, and making sure that we had a plan in place in case we start getting into a crisis mode on how we can kind of come alongside the county, and if there are any policies that have, I guess, negative effects on our small business community, what can we do to get us through fast, right? Or to make sure that everyone's at a equal playing field, so that if we have anyone that's extremely out of line, that's not, and that hits the paper, it doesn't disproportionately hurt the entire industry, regardless of who that business is, who that player is. To be honest, it was very tough to have this conversation I think it turned into a debate. I don't know those who might have watched. It turned into a strange debate, in my perspective, where people kind of wanted to get on their side. Like, I'm on his side, and this is what I think. And the result was somewhat about it. In my field, we call it laissez-faire leadership. It's French for hands off, which means like leadership was expected and then wasn't delivered. Where people are in a position of leadership and they choose not to rise to the moment of leadership, was some of the discussion. Like my doctor's in leadership studies, so I mean, if I had to put a theory on it, that's what it would be. And so it was more, we understand the problem, but we think the county should do it. We also understand that we don't have the resource. We have resources, but we don't want to step on their toes, was kind of the takeaway. And then of course there was the, we shouldn't do anything argument. And then the very next day, we got into crisis mode for the very first time in Wichita's COVID history, which means that like the indicator for the hospitals went to critical, and we had over 90 people in the hospital. So when that is at critical, it means that ICU is filling up. Doesn't just mean with COVID, ICU fills up no matter what, right? Like COVID's usually kind of a small percentage of ICU patients, but when you get COVID patients taking up those beds for 2 weeks, it has a effect on everyone who needs ICU. And that's what we want to avoid, because we get into what's called preventable deaths. That's what really plagued Italy, was someone showing up, having chest pains, not being able to get a bed. So they went home and those chest pains turned into a heart attack, where if they, under normal conditions, they would have had a bed and got admitted and then would have been able to get treated at the time when it escalated. So that's what we want to avoid. We're not at that point now. We're at critical, but we're not at like over capacity yet. Knock on wood. And we have 90 hospitalizations right now. Through this whole thing, the highest hospitalization numbers have been 72, 73-ish, is when we check this number every Monday at 11, by the way. So it's the same time every week that we've gotten this number. So there's no variance in data collection. And hospitalizations are very important to look at, because testing, you can test more people, you can test less people. That's why they have the 14-day average, because like depending on when you put in data, like that number can spike and go a little haywire. So it's important to look at the percentages. Is it going up or down? And then checking hospitalizations and seeing if that goes up and down, because they're independent. Variables where people show up to the hospital because they don't feel good. It's not because they tested positive, right? And then eventually they get tested and they show that they have COVID and they have to get admitted, and there's a standard to get admitted. So not everyone who tests positive for COVID gets admitted to the hospital, and not everyone who's admitted to the hospital knows they have COVID. So they're technically like different indicators. We don't want to read too much into it. It's like, if both of them are going up, we're probably going up. If both of them are going down, we're probably going down. And one balances out the other when you have stuff like, well, hospital numbers are going up because all these people are coming in from out of state. Like, well, then why is Sedgwick County testing going up at the same time, right? Because we're only testing people in Sedgwick County. So if they both are telling the same story, then it's easier to kind of jump to the easiest conclusion. So I tell you that because Dr. Mins at the county level is the one who's going to make any health orders moving forward. That's his job, is to come down with health orders, healthcare orders. The doctors talk to him more than the politicians. And so there might be more stuff coming down. That won't be coming from me, and it won't be coming from city council. And pretty much the quicker we get these numbers down and things safe, then the more confidence people are going to have going out and doing stuff in the economy, and the more likely we're going to get back to somewhat of a normalcy, right? So and someone wrote in here, Andrew wrote, like, stronger restaurant capacity rules for a longer time. I mean, the county and the city did a little more to influence, but that's one industry. Yeah, so I think it's going to be more than mass. I think, another thing and just pointed out is we're probably going to see some limits on, if I had to guess, and I'm not the one who does this, we're probably going to see some limits on capacity. We'll probably see masking. We might see some, if I had to guess, we might see some time restrictions. I don't know, but it's going to probably go beyond masking, right? Like we'll probably see some other stuff. What we don't want to see, I think, is whole swaths. What we're trying to avoid is like swaths of industries being forced to shut down for 2 weeks. That's what we, of course, don't want. But again, I don't know. The doctor's the one doing that. So that's the update. We didn't really have success in having an honest conversation about what our role is moving forward to get things under control, so that if we have to if orders come down, we can help get those orders done with, right? Like get through it fast so people can get back to normal. And also, we see the numbers coming up, so we probably have to brace ourselves for something. I just don't know what that is because there's no blueprint. We're not sure. So, but I'll keep you guys updated. And my role in the background is to ensure that we stay updated with accurate information, and to keep you guys updated, and I won't find out what's happening at the county until it happens. By the way, I don't have a secret link to Dr. Men's. Like I don't get an update until it's already out. Like they just aren't doing that for us over here. So that's also part of it. So just so you know, if something comes down and you're like, I just talked to Whipple and he didn't let me know, it's because I never really, at this point, I've gotten an update before it went public on an order. So that's where we're at. But we'll see. Like hopefully it's a fluke. Hopefully everything will just get better. But we do think the number is going to go up because everyone's going back inside. But so,
Brandon, I have a question.
Questions. Yep.
Just about the county not giving you information until you get it. Why isn't the largest organization inside of the county that essentially works for the largest population of people not the first person that gets notified after their own people? I don't get that. And what can we do to help with that?
To be honest, I would be speculating. I think it has to do some with the relationships. I think it has to do with some tensions, probably some of my fault, where I think some of them felt like I stepped on their toes when we did the mask order. I called the chairman last week, talked to him before I talked to you guys. You know, what can be done? What can we do? Really got no good feedback. During the meeting, I asked, can we have a meeting with the county? Can we in buck meeting or some French word, which means like we're all meeting together. Council didn't want to do that. To be honest, I mean, it sounds petty. But I don't know if there's politics at play. I don't know if it's some relationship stuff, to be honest. And that's good question. Very good question. And the reality is we're at two different levels of government. My interpretation of the rules, where they are in control of a pandemic, right? So public health crises are, when we wrote the rules, we didn't think it was going to ever be like this. It's usually like a bunch of really bad lettuce got mailed to Wichita, and we have to now enforce that people shouldn't be eating this lettuce. Like, how do we do that, right? And it's over in a week. I don't think we secede our power or our authority or our responsibility to the county in a matter like this. I think we join the county, is how I interpret this. We join and we're together in this. And that's how I view this. I think for some reason, a culture here is there's a hard line. And that's our responsibility. Don't cross into our lane. You do your stuff. And that's kind of how I've been told. I just don't accept that, which is why I step on toes. But good question, and we should work on it. It's something that I need to work on too. And I think after the election next week, hopefully guards go down and people are less, people might be less avoidant of working together on things. But all right, so we're gonna continue that discussion. I'll keep you guys in a loop. I think that I have to go more into a less formal discussion about that with the council and with staff. Staff is supposed to also do a bit of a report to see what we could be doing to doing things better. By the way, it's very strange to have this discussion and then fireworks afterwards. Where like what we do to stop loud fireworks, like throughout the community with $250 tickets to and poor areas where people are just shooting off fireworks to celebrate freedom. Like what we do to prevent that versus what we do to prevent like a vicious spread of a deadly virus. Like it was strange to sit there. I'm not sure everyone got that, where it's like we can't do anything. We want to impinge on people's freedoms. We don't want to, we don't have the money, we don't have the staff, and we don't want to work with the county. And then like next item's fireworks, and we're like working with the county, like policing the entire city based on, huge tickets, not $25 tickets. We're talking $250 tickets to prevent 47 injuries, no deaths, right? Like the economic impact is 7 buildings catching fire, which is big, but it's not quite the same as what all you guys are facing. So anyways, but now I'm complaining, and we'll get on to the next item. Any more discussion on this one? So in the chat, Fee just wrote, I think we need to have inclusive conversations and such. We need to have individuals that feel this is our lane, stay in yours. Yes, we need those individuals. That is true. I want to express that I don't think there is a lane. I think we're all fighting the same thing. I look at this as an invasion. If Canada came and invaded us and now they are, taken up, and we got to resist them, and we have some people who want to just accept the reality of the Canadian overlords and accept it. Some people who ignore it, and then I'm the guy who wants to fight it, right? Like I'm going to push them out. So we're all in this together, and that's kind of my thought, is just how do we kind of get all on the same page with it. I think there's some people still who are, I don't mind Canada taking over. I like maple syrup, and like that's where we're at. So,
Mayor.
That's my role. Yes.
Mayor, this is Faye. The reason I made that statement is, and I'm learning so much from this, but we talk about the other view that people have, but I don't feel that we have the people with the other view on this call so that they can kind of explain why they have that other view. I think we're making assumptions a lot of times about how they feel. And so I'm wondering, how can we get individuals that feel differently? I don't think necessarily anybody has a wrong or right now. It's just their feelings, but how are we going to be able to make decisions or even learn if we don't have individuals that have those views on this call? And I don't know how to get those individuals on this call, but I would like to hear from them, like maybe why they feel the county needs to do that or this or that. Because I feel like, and I don't know if this is stepping on any toes, and I'm by no means, I sit and I listen, but everybody on this council, I feel, has kind of the same views. And so we don't have any other outside views so that we can hear the other side. That's just my thought.
Yeah, so I could try to float out there if other members of the council want to be on this, and to see what we get back. I will tell you that they watch this on, they watch our meetings on our, and one of the council members was on our meetings last week when we had this discussion during the emergency meeting. So yeah, you're right. Should we include people who from the city who are, who view, I guess, the role of the city in combating or enforcing any policy related to COVID differently? Like, should we invite those people on for a discussion? That's a good point. That's a good idea. And maybe that's a better way to do it, where, like I said, I feel like, and I know that like Shannon watched, so maybe I'm wrong, but I feel like that discussion was supposed to be an open and honest discussion done in public from the bench from our public meeting. And I feel like it just kind of escalated quickly. And so maybe on a conversation with this group might be a little more productive, because maybe people, this is more like a public forum. So maybe people will have, it won't seem as politically charged, I guess. So maybe you're right. Maybe it'll be more productive.
Well, I'd just like to learn why they feel the way they feel. I mean, there has to be reasoning, you would hope, behind that. So for me, just so I can make informed opinions or what have you, I like to know all of the sides. And so I don't feel like, I mean, and I don't have time all the time to watch all the different meetings, but I do appreciate this forum. And if, you know, they could be present, how could we invite them so we could just learn from them as to why they have the perspectives that they have.
Okay. Yeah, let me see if anyone's interested in joining, and I can let folks know that there was a request by this group to have other members on. I will tell you that we can't have any more than 3 of us on at one time. Actually, we might be able to because this is an open meeting. And I don't think we'll get the whole group, the whole council or anything, but yeah, let me float that and let me check to see, like, would we have to have 3 members at a time, or can we have everyone on, or what that looks like. The takeaway I got was just the idea that the county has the resources. They're the Board of Health. They should be in charge. And my perspective is we come alongside the county for everything, right? Like from enforcing fireworks, from a lot of the stuff we do. We're the largest city, like, you know, we're out and about. What can we do to educate and encourage people to know that, hey, the county came up with this order. This is what it is. Here's a letter. Here's, you know, the information. Try to encourage people to be healthy, because these orders are made to keep everyone healthy. That's where I was taking it. So, and it's different perspectives, I guess. So let me see. I'll float that out there, see if anyone's interested in getting on. But that's a very good point. And I think it'll be a more better conversation with you guys than it was with me, to be honest. So I'm still trying to build relationships here. Not doing a great job, to be honest.
Oh.
Got a ways to go, by the way. This next item is that it's probably going to take us into next meeting as well. There are Are third-party delivery services having a positive or negative impact on local restaurants? So Janet did some research on this. I want to give Janet some credit here, where a lot of cities feel like the Uber Eats type, not just Uber Eats, like lobbyists from Uber, please don't call me and yell at me for using you. But those type of services that go and deliver food from local restaurants to folks at home, that their prices have increased. And there has been a push on a local level to put caps on it, like percentage caps or some type of price gouging mechanisms in it. There's been policy put in place to address it, pretty much. And some of the folks have been from nationally have been concerned that with delivery prices going up from these third-party apps, really these third-party services, it has had a negative impact on local restaurants and businesses, because they're the ones who also have to lower their prices and so on. So now that we know COVID is going to be around for a little while and more people will be utilizing these type of services, have those of you in the service sector notice increases? Is this a concern at this point? I don't know if it's hit Wichita as hard as it's hit other areas. Just want to float that out there, get some feedback. And also, like I said, we'll probably take this to the next meeting as well, give people time to kind of float that around, ask that question as well. Brooke just came on. You got one? What do you think?
Well, it's not good for restaurants, but I'm not sure what the answer is. Basically, when we get desperate enough, we call up the delivery services and say, will you take us on? And then, I think when the stay-at-home order went into effect in March, I think that you can get away with charging higher prices because people will pay that premium to have food delivered. So your margins aren't hurt as much. But if things are kind of where they are now, where people can still, there's still good competition out there and people can go dine in, then you can't really change your prices like that. So you have to be careful. I have a friend who has a restaurant in Chicago, and they just, shut down last week again. And so she's now signed up for the delivery services again and raised her prices by 30%. And people will pay it and be understanding when those orders are in effect. But the problem is times like now when, we've signed up for those services, but we kind of have to like wean ourselves off of them because they don't work from a financial standpoint.
So
but I'm not sure what you do about it.
Well, but right. Well, that's the thing too, right? Like our goal is to get out in front of stuff, right? Is to have conversations about what's happening that's bad and get out in front of it in case there is a solution, in case there is a way we can make it a little bit better. So, but I'm going to ask you as someone who doesn't know this stuff. So you have to actually call like one of these services to get on their list.
Sometimes like Postmates will just sign you up and you won't even know it. And the delivery driver will show up and say, hey, we've got an order. And you're like, we're not even a part of your service. And there's a lot of lawsuits happening against Postmates because of that. But yes, for the most part, that's kind of the deal. And it seems like things have gotten a little bit better in that regard. Because we did sign up with, all the delivery services in March. And I don't think we've had a ton of problems once we kind of got off. We did have some, but I don't, not as many as I expected.
So, okay. And so I'm just trying to understand it. So also, and this might be a little different, but something we should be thinking about. So we did I don't get to sign executive orders, by the way, but I signed something that kind of felt like an executive order where it allowed like alcohol to be like pretty much given out at the streets where people could drive by, pick up and order with alcohol. That type of stuff. Is there anything, and you don't have to know right off the top of your head, but can we think about, is there stuff that is, because I didn't know you couldn't do that, right? Like, is there stuff that is in our ordinance that is standing in the way of delivery services or people driving by and being able to pick up food? Like, part of me even wonders, like, is there like a common alley that we can like shut down and people can drive through and pick up orders and like it's right center where a bunch of restaurants are? Like, what is there stuff we could be doing at the city level to kind of, I guess, help out if we get to the point where people are doing more rather it's regulatory or rather it's just because I think the economy, if the numbers goes up, people are in COVID, people are just going to stay home more. And so, is there a way that we can increase like a drive-through? Like, I don't know. Sorry, Burke, I know you're jumping in, but.
Oh yeah, no, I think things like that. I mean, we should explore that. We should think about it. I think having some sort of outdoor like park where people could pick up food and maybe their booths or something where, it's going to be tougher in the winter months, but like if there are no other options, if dine-in is not an option any longer, then people will go, even if it's cold. So, I mean, there are ways probably we can think about that and things we can do, but I'd have to really like mull it over.
Right. Well, let's.
But yeah, I mean, I think that's obviously something we should think about. I think the extending the drink order, hopefully that will happen if things continue as they are. Hopefully we will be able to continue to do curbside alcohol because that was helpful, especially when things were shut down. And I know it's important to bars. So yeah, I mean, everyone's kind of trying to figure out like how to pivot. I'm so sick of that word. Shannon knows too. We've talked about that. But it's coming back. So we're all trying to figure out ways that we can do things a little bit differently. I mean, I know a lot of restaurants are going to be switching to more provisional items and items that people can kind of do at home. So maybe some sort of, market that the city kind of helps facilitate would be good in that way. Okay. And I know that Wave has done some market stuff with the farmers. So those kinds of things, I think, are probably things we need to think more seriously about heading into the next 3 to 4 months.
Yeah, I'd love to say I could donate my outdoor space if something like that were to come up. Unfortunately, insurance-wise, that might get a little hairy as we've changed our insurance with nobody coming through our doors. But I mean, that would be something I'd love to be in discussion with if it was something.
Right. Well, maybe if the city could coordinate something and there were small fees for everyone and.
Yeah, I mean, you have an outdoor space too, Brooke. You know how fun that insurance is.
Yeah, but I mean,
it's saving me such an insane amount of money to not have anybody come in, which is part of why we're closed.
Yeah.
But, you know, if there were to be something that were I would love to help facilitate something that would help so many others.
So, and that's one of the reasons why we like one of the benefits I get from these conversations, right? Well, where like insurance is an issue, and I'm not an expert on insurance policy at all, but I know that if it's a city event, it then falls under the city insurance, right? Like, so what can we do while utilizing, you know, space over here with the Harkeys while selling, you know, products from not just from Brooke and her establishment, but the other establishments. Like, where is that? What is that? That synergy, I guess, to actually synthesize our resources. So that's something worth looking into. And I think this group we can somewhat, I guess, just keep that in the back of our heads and try to figure out what's a better way to approach this. And like I said, maybe. And Jan's on the call, I'll write it down, but maybe my policy person can also kind of do some research of what other cities are doing. If anything at all comes up that is regulatory within our ordinance that is standing in your way of surviving doing any type of service right now, like immediately let me know and we will work to eliminate that piece of red tape. That's something I think that the council has an appetite for doing. We're finding little lines in the code or the ordinance that is stopping people from being successful here. We do have very strict liquor licenses or liquor laws here, right? Like, so it's almost archaic, some of the stuff we have. So like, all right, well, what's left over from prohibition that is now like, we don't need anymore. And the unintended consequence of that line is keeping Brooke from being able to sell, you know, a package deal of mixed drinks with dinner.
Right.
Let's eliminate that. So that type of stuff too. But I'm interested to know more, and maybe, you know, we could think about this for next meeting, about the third-party delivery services. I can get out, I think, I don't know if she sent it to you, but my assistant gave me like a list of cities on how they're dealing with it. And I'm not sure if we can, and if I was to do this, by the way, like it'd be immediately like, once the legislature got back in session, like they would make it so you can't do this anymore. But if we put like a cap on like delivery services where you can't charge 100% more than what the food actually costs, like if we did anything like that, like I'm sure I'll get pushback on it. But that's how some other cities have been dealing with it. Is there a way? I'm not saying that's how we should deal with it. Is there a way though that we can?
I mean, we would be for something like that. I don't think it's good for restaurants. I don't think the delivery service platforms are good for restaurants. But obviously, there are lots of restaurants out there that serve a variety of different items that probably have more success with it, and their margins are different than ours. So I would suggest maybe a survey to see how other people feel about it.
Can I wait?
So that we can kind of gauge that. That's how I feel. That doesn't mean, you know, like our restaurant's so different than a lot of other places. So, and obviously they span the gamut. So,
Andrew, are you jumping on that?
Yeah,
Okay.
I wanted to chime in a couple things just to get it on record. So there's this is a state issue at some level. There's liability, for example, in third-party delivery, and how you hear this all the time. It's the Wild West of food service and tech and whatnot. The thing that I think most all restaurants are going to agree on is that the fees are always too high. And if you as the city have to go through and help limit the expense, then you could actually create profit for businesses. Because I'm reading right now on the takeout.com, and it's titled literally "Nobody's Making Profit with Third-Party Delivery." So we do it as a mean to help get product off our shelf and to help pay for the labor, but the business has to make money in order for this to work. And so if you can help limit and lower that, I think you're going to get unanimous support from restaurants and businesses, as long as it doesn't take away some factor that helps the business. For example, if they turn around and say, we'll cut our fees, but then we take away all your marketing. Now, if you want to pay more to get better exposure, that's maybe up to the business perhaps. And I like that idea. The issue I think that you're going to run into, that I would love personally, and I know a lot of other business owners would, is in the liability of getting some definition about who carries the liability. Because right now, when you walk out of a restaurant with a bag of food, the restaurant still is going to be held liable. The third-party delivery systems, and you can go sign up to be a driver and you can read the document. It'll tell you flat out, they have no responsibility for the food, even though they're the ones coordinating it. They are a connector. They're not, the contractor driver, it has some liability for what they do, but who are they going to go after? They're always going to go after the restaurant, because we're perceived as the one that has caused the problem. And after the fees, the number one thing I'm concerned about with these programs is they're representing our businesses. Postmates is like an example. Brooke brought that up earlier. We had our first Postmates order yesterday. We don't have Postmates. They were ordering food that we haven't served in 6 months. And it's like, that's the kind of crap that we deal with. And then on top of that, we go on their website and look, and they're charging like double what we would have charged for that service. And it's just baloney. So anyways, we refuse those services, especially that kind where they come in and they essentially act as a fraudulent type transaction. And that's where the legal battles in that particular company. But I would be all for lowering the costs and then getting liability established. And that's a state issue, though. We have to run through the state. And that's actually been, for the last year or so, been looked at. According to the KRHA, they've been looking at it and trying to figure out the best way, but they figured it'd take a little longer. And now with the pandemic, I don't know if that's going to expedite it or push it back. But we want to get the liability off our hands, because I don't want to be responsible once it walks out the door.
See, and that's a huge policy piece that I didn't even think of, right? Like,
yeah, I mean, money's one thing, but then income, but like if you kill a business because they kills a person, like that is so much more important. But it's insurance. It's the last thing we think of until it affects us. So
right, like it's one of those, like you do lose control of the product to a third party, and if that third party for some reason doesn't deliver, if that product gets tainted between your restaurant and delivery, then it's your restaurant on the line. And that's because anyone who delivers food in your restaurant is, as an employee, you have control over. You can train the people, they have food serving licenses or handling licenses or whatever. Right. Like, yeah, there's a level of control there. But me picking up, food, and let's say food that's supposed to be cold, like raw sushi or something, putting it right on top of a very hot item I'm also delivering, might actually make that now more dangerous to eat. So yeah, stuff like that, that's interesting. I didn't think about that.
And the other issue that we deal with after the cost is actually before we think about liability. It's like this business is now representing us whether we like it or not. And so if the product temperature is an issue, if it's spilled all over your container, the driver never gets criticized for that. They might lose some revenue and service because there's some arrangements within those entities to depending on the issue, whether they refund the customer directly from their pocket or from, to go back to, it's confusing. Only the operators that run them know how they work. But the point being, it's like they're representing a business. So they spill your food all over, that's going to always fall back on the restaurant, even though this was just some deployed person we had no control over. We don't know who they are. We don't know what their names are or what their experience is. They have zero food safety handling. They don't have any of that, but yet they're going to be held to the same standard as a restaurant, which, anyways, we want that issue to be solved simultaneously.
Okay. All right. That's interesting. Yeah. And that might be a legislative issue. But after next week, we'll know what the field's going to look like as far as who's elected, who's not. And we are putting together our legislative agenda right now for the city. So if we had, and there's right now, and just kind of off topic, but kind of not. There is a appetite to address insurance, who insures what, if you have like an intern on a job site. So if you got like a 17-year-old student who wants to cross train in high school with vocational training, and they're at a job site learning how to build houses, learning how to do construction, learning something, and that person gets hurt, whose insurance does that person fall under? Is it the business or is it the school? So there's kind of this, because we're trying to, it's a similar problem, right? Like, but there is an appetite to address some of those type of issues with insurance. So if we kind of also, as the city of Wichita, hey, my small business council wants us to look at this as well, then while they're digging into that at the legislature, maybe they could dig into this issue a bit and see if there's a solution. So that's important. And we got a little bit till we kind of hammer out exactly what we're looking for at the legislative level to kind of give them guidance. But we could probably put that, or possibly put something like that on our agenda, which means the city lobbyists will be the ones who could talk about this to the chair of the insurance committee. So we might be able to see some legislative change with that, is what I'm saying, because they're already going to start digging into that area of law this year, I think.
Can I ask a quick question to Jesse? What have you guys done about like ASCAP fees and that sort of thing? And is that something we could get help with?
We're just ignoring ASCAP fees right now. I mean, we're paying the bills we have to pay right now, and just putting them on the other side of my desk for now. You know, we're in hibernation mode.
I know that's a problem for a lot of people. So
I know
it's going
Neva's
to be a problem because they've got lots of lawyers.
we are trying to address that within NEVA. Can they join NEVA?
Brickyard could, for sure.
Yeah.
Are you guys in NEVA?
Yes, I think so.
Okay.
Yeah.
I was going to suggest you guys really should.
But I'll check today.
Theoretically, once this whole exciting phase of life is over, there's going to be a lot of really good coming out for all venues. So I would just suggest jumping on, because hopefully,
So
will look better. But yeah, for now, I'm just ignoring ASCAP and BMI. And I mean, we're not
we're just talking about music licensing fees, and a lot of restaurants have to pay those too. I mean, some places are able to get around that, but a lot of small bars that aren't venues necessarily also pay those fees.
Yeah.
To us or to an association?
No, to 3 different music licensing companies.
Are you required to have music licenses in Wichita?
If you want to play music, yes.
Yeah.
Yeah, it goes back to the 60s when the mob controlled the music industry.
That's what it feels like.
It has to do with what happened in World War II. Sorry, I am not teaching anymore. So in World War II, when the draft was instated, you know, a lot of musicians went overseas, obviously, and then live music fell apart. It was not as bad as this though. But so live music, which at that point then canned music became much more popular. And then, you know, as Adam stated, the mob was heavily involved with the music scene at that point, also stemming from Kansas City.
Well, they owned most of the labels, and they were heavily involved in management of artists and all that.
So it was pretty much, Adam, I lost the word. What's the word?
Extortion. It's legalized extortion.
It's legalized extortion. It's saying that they're trying to benefit the artists, but the artists very rarely see any actual amount of money. So there's 3 entities we're all required to pay. But so like for us, we're not required to pay them right now because, well, I'm saying we're not required to pay them right now because we're not open. So therefore we're not playing music for the public, but everyone else who's playing music over their speakers, they are legally required to pay those fees.
I would push back though, because most of those deals are based on, you know, your capacity and how much business you do and a plethora of things. So pushing back and saying that you're open to limited capacity, or, you know, you're closed or you've been shuttered or whatever, and say that, you know, you either need to renegotiate the contract or need to have some kind of forgiveness on it we've seen it work across the country with venues specifically, but I think it would spill over into all other businesses too.
Interesting. Yeah, I wrote down a bunch of acronyms so I can do some research, but
Andy put
yeah,
them in the
I
chat
had no
as
idea.
well.
Is what?
Andy was kind enough to put them in the chat as well.
Okay, excellent. So the we're over a little bit. I wanted to just jump in and with Adam here, he's usually talking to his lobbyist. If we can get like maybe a 5-minute, is there any rumors or anything from DC for the good of the group that you might be able to rumor? Like I said, like no one knows about DC. What could or couldn't happen? It's a wild place. But is there anything that maybe you're hearing that might be good for the group?
We're just gearing up right now for post-election advocacy. There's nothing going on in DC. Everybody's, all the Congress is back at home running their campaigns. So it's on pause. And so our calls this week have all been strategy meetings to come up with our game plan for when they return in November and post-election. So, we're hoping that there will be some movement in lame duck, but not counting on it because they won't have any reason to do anything, which, obviously they have a big reason to do anything because the whole country is collapsing, but, I'm not sure that that's going to push the needle, unfortunately. So, but we are going to start a big campaign post-election. So it's just been strategizing and getting ready for that. So yeah, no movement currently, but we're hoping that we're hopeful that post-election there will be an overall relief bill. And we're going to start a big push for it.
Okay. Well, let's stay up to par on that. We also have a lobbyist at the city level, and the service industry is a huge part of our economy. We have a lobbyist at the federal level, and as a city, we have an interest in keeping our small business community active and get through this. So there might be some appetite to tag team with different lobbyist groups on similar bills coming through. So let's talk about that when election's over, if there's some legislation make its way through that would benefit our small business community directly here in Wichita, maybe we can use our Wichita city resources to also get our lobbyists on supporting those bills as well. Right now, he usually is focused on getting $21 million for us to fix highways and stuff like that. But we could probably get working on different stuff as well. So, all right. So we're about 12 minutes over. We usually go about 15 minutes over. So for the last 3 minutes, are there any other thoughts before we leave? We'll keep you guys posted. We'll keep the chat going on online if there's any. I think between now and next meeting. Andrew, go ahead.
Buried in the comments, somebody had made mention about vision, and I don't know if that was directly related, but I guess it's just one thing that should come from this group is kind of like what we vision the community moving towards or becoming at some point, so that when people ask what is our primary objective, why is this kind of group of people that tend to agree with each other, what is our hope and vision? Hopefully it lands on something that everybody would go, oh yeah, I believe in that too, because I believe that we all are interested in business thriving and people being healthy, etc. So it'd be great to have that be formalized because people are watching. I know that because I've calls after every one of these meetings.
And my thing too is, and eventually we should kind of do that, where work on a mission statement or a vision goal, a vision statement. To be honest, my experience in politics is the big industries they have a lobbyist, they have someone. Small businesses usually don't. So I formulate this group to try to figure out how do we get more voices to the table who otherwise might not, get to the table in more of a unified manner. But also we got COVID, we got all this other stuff kind of flying at us. So, but yeah, I think that it's important to take what we've been doing, what we are doing, and then kind of put that into a statement so it's easier to explain what we do, I guess, why this is. And I agree with you, Andrew. I think that doing that after we've had some meetings and after we start kind of showing what we're doing would be more accurate than trying to come up with this before we let this group kind of form into what it is, right? Naturally kind of become what it is, and then we can describe what that is. But yeah, that's a good point, because I do think that it's becoming more of a formal group, more, I would say even respected in city hall as an actual official group. And we could do stuff to kind of make it more official, like having that vision statement. Something worth thinking about. Okay. A good point. All right. So we got the chat up. Sorry, I haven't kept up with the chat, but we'll be able to look at that afterwards. Any more comments? Like I said, we're exactly 15 minutes over, which means we're on time for us. So if not, we can stop. Thank you everyone for being on. Our next scheduled meeting will be in 2 weeks. With the increase in COVID, with everything going on, if anything comes down the pipe from the county level and it's affecting you guys directly, I might again call another emergency meeting to see what can we do, right? Like, or you know, we want to always respond, not react, right? So what is the best way to respond as the business community, as the city? But if not, our next meeting I think will be in 2 weeks, and we'll continue the discussion. So, thank you all. Appreciate it.